Good morning, everyone. I'm here to discuss the different blood and tissue protozoa, including their life cycle, diseases, treatments, and prevention control. So, the blood and tissue protozoa include apicomplexia, flagellates, and free living amoeba. So what I only have to discuss are the flagellates and free-living amoeba, including the Leishmania spp and Trypanosoma. So let us start with subphylum Sarcodena, specifically the Acanthamoeba. It is a minor protozoa and a free-living amoeba. It commonly found in soil and contaminated water, so it is able to survive in cool areas or in the water. So it usually causes infection in immunocompromised patients. So when we say immunocompromised patients, it is the body's immune system's defenses low, so which affected the ability to fight for infection. So it also causes inflammation of the brain substance and its meningeal covering. So the meningeal coverings provide support framework for cerebral and cranial vasculature. The three layers of meninges are the dura mater, the arachnoid mater, and the pia mater. So it has two morphological forms, the trapezoid and the cyst. So trapezoid is extremely variable in shape. It has a size of 10 to 40 micrometer in diameter, while cyst also vary in shape and it measures 15 to 20 micrometer in diameter. So there are two ways in which a parasite can be acquired. It could be through nasal inhalation or through direct invasion of the eye. So, the people can acquire this infection through swimming in contaminated water and also those people who uses contact lenses. So, the life cycle of Acanthamoeba is this. Acanthamoeba can be multiplied by mitosis and increased in number. So both cysts and trapezoids are infectious. So remember that in infective stage is the cyst and pathogenic stage is the trapezoid. So here in the picture, so these two morphological forms will enter to the body. The cyst will enter the body through dust that inhaled by the human or through the eye. So and the trapezoid will enter to the human in through ulcerated skin or the broken skin. So, through nasal passages to the lower respiratory tract, so they will go along with this lower respiratory tract and distributed in many blood vessels, which will go or directly go to the central nervous system. So there are basically two diseases caused by protozoans. First is the keratitis. As you can see in the picture, there is a reddish eye. So keratitis is an infection of the cornea of the eye. So the symptoms include severe eye pain and vision problems because protozoa or the infections will infect or can invade the human body through the eyes. So next is the granulomatous amoebic encephalitis. It also occurs primarily in immunocompromised individuals. So the parasite produces produces a granulomatous amoebic encephalitis and brain abscesses in immunocompromised patients. So in the picture, as you can see, this is the brain that affected by granulomatous amoebic encephalitis. So in symptoms includes headache, seizures, stiff neck, nausea, and vomiting. So in laboratory diagnosis, first is finding of both trophozoites and cysts in the cerebrospinal fluid as well as brain tissue and corneal scraping. So it is important to identify or to find the trophozoite and cysts in the brain to avoid the spreading of infection. So histologic examination of corneal scraping may also be done, and through the use of chalcofluoride, you can demonstrate the fungi and the parasite in corneal scraping specimen. So this is the histologic examination of the eye that affected by disease. Then for treatment, it could be treated by pentamidine, ketoconazole, or flucytosine. So in eye and skin, it could be topical miconazole, chlorhexidine, itraconazole, ketoconazole, rifampicin, or propamidine. So this is an example of pentamidine. And this is for miconazole for the eyes. Then, for prevention or control, adequate boiling of water and regular disinfection of contact lenses. So, this is the ways to do for disinfection of contact lenses. So, that is for Acanthamoeba. Next is the subphylum Sarcodina, specifically the Naegleria. So, similar to Acanthamoeba, it is also classified as free-living amoeba. So, it only differs to Acanthamoeba because it is or it can survive in thermal spring water or hot water. So, Acanthamoeba survives in cold water while this Naegleria survives in hot water. So, it is commonly found in soil and contaminated water. So, the known pathogen worldwide is Naegleria fowleri. So, it is the only amoeba which identified three morphologic forms, the C stage, the trophozoite stage, and the flagellated stage. So, the C stage is the non-motile form, while the trophozoites exhibits the typical amoeboid motility and is described as slug-like. And the third is the flagellated stage, which formed in pear-shaped and responsible for the parasites spinning movement. So, Naegleria infection is usually acquired transnally in swimming in contaminated water. So the parasite penetrates the nasal mucosa and cribriform plate. So it enters the central nervous system and produces a fatal meningitis and encephalitis. So unlike Acanthamoeba, the parasite produces infection in otherwise healthy individuals or that usually children. So in some instances, it may be acquired through inhalation of dust containing the parasite. So the entire life cycle of the parasite starts from amoeboid trophozoites to flagellate trophozoite to amoeboid trophozoite and through a cyst form. It occurs entirely in the external environment. It starts with the infective stage or the cysts, and through the mitosis, it becomes trophozoite. This is the infective stage already and goes along, it becomes flagellated form, then it forms in the water. So, the father and the son swimming in contaminated water, the infection or the infection will enter to their nose, and the amoeba penetrate the nasal mucosa and that amoeba migrate to the brain via the olfactory nerves, causing primary amoebic meningoencephalitis or the PAM in healthy individuals. And the diagnostic stage is the tropozoites in CFS and brain tissue, flagellated forms occasionally in CSF. So for the diseases, first is the asymptomatic infection. It is the common clinical presentation in patients with colonization of nasal passages. And then for the primary amoebic meningoencephalitis, the result of colonization of the brain by the amoeboid tropozoites leading to rapid tissue destruction of the brain. So patients initially complain of sore throat, nausea, vomiting, fever, and headache. Patients eventually develop a sign of meningeal irritation. So this is the brain that is infected by primary amoebic meningoencephalitis or so for diagnosis, it is based on the finding of the amoeboid tropozoites in cerebrospinal fluid. So here they identified the amoeboid tropozoites. Then for the treatment is ineffective because of its rapidly fatal course. However, some patients have been shown to recover from infection due to the early detection and initiation of treatment. So treatment of choice is amphotericin B in combination with miconazole and rifampicin. So it is for injection treatment. So prevention and control. There is a known means of preventing Naegleria infection other than the prevention of contamination of water sources. So adequate chlorination of swimming pools and hot tub is recommended. So it is recommended to disinfect the swimming pools because swimming pools can be contaminated. So now we move to subphylum Mastegophora hemoflagellates Leishmania spp. So these are obligate intercellular parasites and has three morphological forms or morphologic forms. These are mastigote, premastigote, and epimastigote. The pathogenic stage and diagnostic form is the mastigote, which primarily found in tissue and muscle as well as in central nervous system. Premastigote is the infective stage and it may be seen only if a blood sample is collected and examined immediately. Then epimastigote is found primarily in vector. So the typical mastigote is round to oval in shape and contains nucleus, while permastigote is long and slender with a single free flagellum extending. So the parasite has distributed worldwide. So natural reservoirs include rodents, ants, dogs, and cats. So these are the major strains, the Leishmania donovani, Leishmania tropica, and Leishmania brasiliensis. This picture shows the life cycle of Leishmania spp. So leishmaniasis is transmitted by the bite of a female phlebotomine sandflies. So the sandflies inject the infective stage permastigotes during blood meals. Then permastigotes that reach to the punctured wound are phagocytosized by macrophages or the other types of mononuclear phagocytic cells. Phagocytized means to engulf. So these promastigotes transform into amastigotes, which is round, and amastigotes multiply in infected cells and affect the different tissues depending in the part on the Leishmania species. So this originates the clinical manifestations of leishmaniasis. So sandflies become infected during blood meals on an infected host and they ingest macrophages infected with amastigotes. So in the sandfly's midgut, the parasites differentiate into permastigotes which multiply and migrate to proboscis. So this is the whole life cycle of Leishmaniasis or Leishmania spp. So the first strain is Leishmania donovani complex. So in 1900s, Sir William Leishman discovered L. donovani in spleen of the soldier who died of fever. So L. donovani is a causative agent of visceral leishmaniasis and it also known as Kala-Azar or Dum-Dum fever. So it is mainly seen in Central America and transmitted by Lodzomia sandflies. So L. donovani, found in parts of Africa and Asia and is transmitted by Phlebotomus sandfly. And last is L. donovani infantum, found mainly in Mediterranean Europe, Near East, and Africa and transmitted by the Phlebotomus sandfly. So the disease is the visceral leishmaniasis or the Kala-Azar or Dum-Dum fever. So after the incubation of 2 weeks to 18 months, the disease begins with intermittent fever, weakness, and weight loss. So, splenomegaly or massive enlargement of the spleen may also occur. Hematomegaly or enlargement of liver can also occur. So, in light-skinned patients, hyperpigmentation of the skin may also occur. Thrombocyte thrombocytopenia, anemia, leukopenia, and glomerulonephritis. Yan. So this is the picture of a child having visceral leishmaniasis or the Kala-Azar or Dum-Dum fever. So next we have the diagnosis of visceral leishmaniasis or the Dum-Dum fever. So the screening test is called the Montenegro skin test. So this test is similar to the tuberculin skin test of the diagnosis of tuberculosis. So it is used as screening for large populations at risk, but it is not used for diagnosis. So definitive diagnosis is done by demonstration of a mastigote of Gemsha, stained slides of specimen from blood, bone marrow, lymph nodes, and biopsies of infected areas. So culture of blood, bone marrow, and lymph nodes may also be done, which will show the permastigote's forms. So serologic tests are now available such as indirect fluorescent antibody, enzyme-linked immunoservice assay, and direct agglutinin. So for treatment, the present recommended drug of choice is liposomal amphotericin B and also sodium stibogluconate can also be used. So other patients have occurred or have favored responses to gamma interferon in combination with pentavalent antimony. For prevention and control of vector populations is important in prevention and control. The use of insect repellents and protective clothing and installation of screens may be helpful to prevent and control such flies to avoid having disease. So this old world cutaneous leishmaniasis disease is characterized by several pus containing ulcers that may heal spontaneously. So the initial lesions are small pruritic red papule at the bite site. So in patients with allergy and hypersensitivity responses, spontaneous healing does not occur. So thick skin plaques with multiple nodules may develop. So this is the old world cutaneous disease looks like. And then for our diagnosis, microscopic examination of germs has stain from beneath the ulcer bed is the usual diagnostic procedures of choice. So microscopic examination can also describe or can also reveals the typical amastigotes. Then culture specimen will show the promastigotes form and the serologic test may also be available. So for treatment, the drug of choice is also the sodium stevoglutinate. Then steroids with application of heat to the infective lesions may be used, and other alternative drugs just like meglomine, antimonite, pentamidine, and oral ketoconazole. So paramomycin ointment may be helpful in the healing of ulcers. So for prevention and control, preventive measures are the same as those for the different forms of leishmaniasis. So, however, unlike the other leishmania, this disease has a vaccine that has been developed against L. tropica, which is undergoing clinical trials. So, next one is the trypanos. So the next one is Trypanosoma spp. So the trypanosomes are also hemoflagellates like Leishmania. So the major difference between the two lies in the diagnostic stages. So with which is a mastigote for leishmaniasis and the trypamastigote for trypanosoma spp. So the trypamastigote is curved, assuming the shape of the letter C, S, or U. So unlike leishmania, the kinetoplast of the trypomastigote is posteriorly located with a single large nucleus located in the interior to it. So it is visible in the peripheral blood. So this is the trypanosoma looks like. So the kinetoplast, it has nucleus also, it has flagellum and at the anterior end, and then kinetoplast at the posterior end. So we have Trypanosoma cruzi. So the parasite is found primarily in South and Central America, specifically in rural areas. So acute infection first found in United States, while chronic infection in Latin America. So it is transmitted by rudovid or tritomid bud or the kissing bud. So this is what Trypanosoma cruzi looks, and this is the kissing bud. It is called kissing bud because they are like to feed in your nose or in your eyes. So the life cycle of Trypanosoma cruzi, it starts with triatomine bug stage. So an infected triatomine insect vector or the kissing bug takes a takes a blood meal and releases trypomastigotes in feces near the site of the bite wound. So trypomastigotes enter the host through the wound or through the intact mucosal membrane such as conjunctiva. So common triatomine vector species for tryposomiasis belong to the genera Triatoma, Rudneus, and Panstrogylus inside the host. The trypomastigotes invade cells near of inoculation and they differentiate into intracellular amastigotes. So the amastigotes now and multiply by binary fission in cells of infected tissues and differentiate into trypomastigotes and then The trypomastigotes infect cells from a variety of tissues and transforms into intracellular mastigotes, then burst out of the cell and enter the bloodstream. So the kissing bug becomes infected by feeding on human or animal blood that contains circulating parasites. The kissing bug becomes infected by feeding on human or animal blood that contains circulating parasites. Then they the kissing bug becomes infected by feeding on human and animal blood that contains circulating parasites. So the ingested trypomastigotes transforms into epimastigotes in the vector midgut, and then the parasites can multiply and differentiate in the midgut and differentiate into metacyclic trypomastigotes in hindgut. These are the routes of transmission or the possible routes of transmission for this parasite. It could be in oral routes, it could be sexual transmission, work accidents in laboratory, congenital or transplacental for the babies, blood transportation, organ transplant, and vector transportation. For disease called Chagas disease or also called American trypanosomiasis. So this is the man affected by the kissing bud. The eyelid swelling may be due to the bug feces being accidentally rubbed into the eyes. So it is accompanied by fever, chills, malaise, myalgia, and fatigue, and it begins with nodule near the right side and unilateral swelling of eyelids. It also causes hepatosplenomegaly and lymphadenopathy or the enlargement of lymph nodes, myocarditis with cardiac arrhythmia. So the diagnosis of Chagas disease is through finding of trypomastigotes in thick or thin films of the patient's blood. So other diagnostic methods that can be used include the bone marrow, aspiration, muscle biopsy, culture and spatial medium, and xenodiagnosis. So xenodiagnosis entails allowing an infected laboratory raised redo feedback to feed on an infected patient. So after several weeks, the intestinal contents of the bug are examined for the presence of the parasite. So also serologic tests can also be helpful. So both xenodiagnosis and serologic tests are useful in the chronic form of the disease. So for the treatment, so the drug of choice are benzidazole and nifortimox, then allopurinol and ketoconazole. So these are the example of the drugs or the medicine that is helpful for the Chagas disease. And for prevention control, protection from the bite of the Ridovit bug, improvement of the housing condition and insect control, and of course, education regarding the disease and its transmission are very helpful. So that could be all. Thank you.